You've been dealing with pain, fatigue, and maybe even infertility, and now your doctor has recommended surgery for endometriosis. That alone can feel overwhelming. But don't worry. Today we'll walk you through what to expect before, during, and after endometriosis surgery, from how to prepare and what recovery looks like, to what outcomes are realistic. This video will help you feel confident, informed, and supported. Welcome to Clarivive MedInsight to learn differently. So let's start. 1. What type of surgery is used for endometriosis? The most common surgery for endometriosis is called laparoscopy, also known as keyhole surgery. It's minimally invasive, meaning small cuts are made in your abdomen, and a tiny camera helps your surgeon see and remove or burn off endometrial lesions. There are two main goals. Diagnosis, seeing where and how severe the endometriosis is. Treatment, removing lesions, adhesions, or cysts to relieve symptoms. Sometimes your surgeon may also remove scar tissue that's affecting fertility or organ movement. 2. Before surgery, how to prepare. You'll have blood work and imaging tests like ultrasounds or MRIs. You'll meet with your surgeon to go over the plan. You'll be told to stop eating/drinking for several hours before the procedure. You may need to arrange time off work, usually 1 to 2 weeks for basic recovery. Prepare your home. Stock soft foods, loose clothing, heating pads, and pads. No tampons post-op. Also, take time to ask any and all questions you have. Your doctor is there to help you understand what's happening to your body. 3. During the surgery, what happens in the operating room? The surgery itself typically takes 1 to 3 hours and is done under general anesthesia, meaning you'll be fully asleep. Here's what happens. A small incision near your belly button lets the camera in. 2 or 3 more small incisions may be made for surgical tools. Carbon dioxide gas inflates your belly so the surgeon can see clearly. Lesions, scar tissue, and cysts are removed or cauterized. If something unexpected is found, like a deeply infiltrating lesion, the surgeon might adjust the plan. That's why it's important to work with someone experienced in endometriosis care. 4. After surgery, immediate recovery and what to expect. A. Right after surgery. You'll wake up in recovery with some grogginess and abdominal soreness. You might feel bloated. That's from the gas used during surgery. Pain meds will be offered to help manage discomfort. You'll likely go home the same day, but some people stay overnight. B. In the first 24 to 72 hours, expect shoulder pain from the gas, mild spotting, tiredness or dizziness, sore throat from anesthesia tube. Listen to your body and rest as much as you need. 5. Recovery in the first few weeks. Here's what week-by-week recovery can look like. Week 1, lots of rest, short walks only, no lifting. Week 2 to 3, energy slowly improves. You may return to light work. Week 4 to 6, most people feel physically much better. Beyond 6 weeks, internal healing continues for a few months. It's normal to feel emotional during recovery. Your hormones may shift and the physical healing can feel frustrating. Remember, healing isn't just about your scars. It's about your whole system. Will surgery cure my endometriosis? This is the most important question, and the most misunderstood. Surgery can reduce or relieve symptoms dramatically, especially if done by a specialist. But it's not always a permanent fix. Endometriosis is a chronic condition, and in some cases, lesions can return, especially if surgery wasn't complete or deeply infiltrating endometriosis wasn't addressed. That's why post-surgery care is crucial. Anti-inflammatory diet, hormonal management, like birth control or GnRH therapy, regular check-ins with your doctor. Surgery isn't the end of your journey, but it can be a powerful turning point. You're taking control of your health. You're choosing healing. And last, you're not alone. If you found this video helpful, subscribe to Clarivive MedInsight and let us know in the comments. And here's the question of the day. What part of surgery are you most nervous or curious about? We're here to guide you through every step of this journey. In tomorrow's video, we'll talk about what your cycle might look like after endometriosis surgery and how to know if it's improving. Thanks for watching.